Welcome
Welcome
to Don't
back.
Repeat What Mommy Says.
Don't repeat what Mommy says. Sorry, I just realized my face was like really close. I was trying to read something. So, um, we weren't originally going to do an episode for Black History Month. Um, Nothing against it or anything. It just we aren't Black people, and I don't think we can really speak all that well on the struggle of Black people and about Black history, but then something came up on social media. It's not the first time I've seen it. It's actually been a few incidents on social media, and it just really ticked me off. So, we've talked before about how women are treated by the medical field, and it's crap. We're treated like we're hysterical. We are treated like our pain is minimized. It takes longer to get diagnosed. But an even bigger disparity, and we've mentioned it before, was how Black women are treated in healthcare.
Mhm.
And what kind of was the catalyst um, was a video I saw, which is not the first one, I think it was like the third one I saw, of a Black woman in labor being completely dismissed by the medical team. And this particular woman ended up delivering her baby in the hospital elevator after they sent her away. And just really ticked me off. So I figured we'd talk about that today because what the hell? Like, what the hell is going on? just so I don't know. Do you have anything to add before I go on?
No, the medical community has a huge stereotype of women in general, but even worse so with black women because I told you before the show when I had Paige, so it's my first baby, whatever, and I heard some lady who was really sounding like it was not going well. And it kind of freaked me out, because I could hear her, and the nurse is like, well, she's a black lady. They're just like that. They're really dramatic. And I was like, excuse me? Like, I couldn't. Um,
Yeah.
so, no, I didn't know that was a stereotype in the medical community until that happened. And then I've heard similar things said since, and I can't even
I can't.
I don't even know what to do with that. It makes me
It makes me so angry. So the statistic, and we've mentioned it before, was basically that Black moms, first of all, the maternal mortality rate in this country is one of the highest of all of the developed nations in the world, which is insane to me.
mhm.
Um, so that number is already too high. Granted, it is still a low percentage, like your chances of dying in childbirth are fairly low. However, the chances of a Black woman dying in childbirth is 3 times the rate of white women. It's actually over 3 times the rate. So I pulled the statistic because I was mad. Um, so let me find it. But it was saying for, hang on. As of 2023, and this is per the CDC, for every 100,000 births, there were 15.5 mortality rate or fatal outcomes for white mothers, compared to Black women per 100,000 births at 50.3 deaths. That is outrageous.
Did they study why or no?
Um,
Or they're just like, well, that happened. Or what? I
well,
mean, has anybody tried to figure out why?
there have been some thoughts as to why, and there's a lot of factors from what I was reading. One is, of course, there's a socioeconomic thing in terms of access to healthcare is different in some areas of the country, and those areas tend to be disproportionately Black. Um, Another was Black women are less likely to be believed about things like their pain level or the amount of bleeding they're having. They're more likely to be stereotyped as hysterical or dramatic.
Mhm.
And that goes for more things than just in the labor and delivery department. Black women are more likely to end up with preeclampsia, but take longer to get diagnosed typically. They're less likely to receive treatment for pregnancy complications that are more likely to happen, which is really gross.
So do you think that it is like on purpose
I
from the medical community, or is it a prejudice that they don't know they're having? Like that, I really want to know because if we don't know why it's happening, it's never gonna stop.
Yeah, and I know, so I actually asked the mom group people, love my mom group people, if they had information on it. So they sent me a bunch of resources, and now I have to find them again because I lost them, of organizations that are actually like working to push for legislation and push for changes within the medical community that would help things like this. Because my argument was, I didn't just want to come on here and bitch. Like, obviously, I'm here, I'm bitching, I'm mad about it. And we're going to talk about some of the history too, in terms of black women in medicine.
That's pretty horrible.
It's pretty horrible. So this is probably going to be a less fun one because I'm really mad. But instead of just bitching, I wanted to actually have some resources to discuss. So one was blackmamasmatter.org. And that is an organization that's they do events and they give people like I believe they have stuff for like resources for if you're going into a new doctor, something like questions to ask, tests that you should be requesting, things to be looking out for, so you can advocate for yourself better. Um, Another one, Black Maternal Health Caucus, is actually a government website, and they list 9 different organizations on the Black Maternal Health Caucus that are working to improve healthcare outcomes for Black mothers.
So,
So
is there any organizations if you're a black woman and you're pregnant, that like that you could contact? Do we know?
I don't
Did I
know.
just throw something at you? I'm sorry.
I don't know. I didn't research into it quite as much as I should have before the show. I believe the Black Mamas Matter had resources for stuff like that.
Okay, so maybe if somebody looks them up, they could at least point them in the right direction.
Yeah, I'll try to drop some links in the show notes too. But they had, I know on their website was a recent one, was talking about infertility and delayed care in Black communities. Um, so there's a lot of discrepancy in how healthcare is managed for Black moms, unfortunately. Um, but it looks like there are some organizations. So what did I say? The Black Maternal Health Caucus. I'll put the links in the show notes for those too, because that one had a link to 9 different resources within it.
Oh, nice.
And then the Black Mamas Matter is its own organization that is pushing for legislation and changes to the way that women's health is handled in relation to Black mothers.
Well, and maybe the hospitals hopefully will get a clue and, start doing something with their medical teams.
Well,
I
and
don't know
please,
what they can do. I mean, obviously, they need to have a standard across the board. I mean, because they'll ask you, what's your pain level? Why shouldn't the standard be the same? I mean, because to be fair, like the standard's not great for any woman.
it's
Really,
not.
it's not. I mean, I almost hemorrhaged to death after my first baby. So,
Yeah,
and that
and
was just stupidity from my medical team. Well, and myself because I was mad, but there's that.
yeah, and this isn't to say that all members of healthcare are acting like this, but there is
No,
a failing somewhere in the system at large where these women are not getting the care that they need and they are literally dying because of it.
and they're not getting the care fast enough or like getting diagnosed with things that they need to be diagnosed with. Like if you have preeclampsia, you need to know that.
Yes, so one that I saw, and this is another reason I wanted to make this episode, it was a woman in this horrible first time moms Facebook group, whatever. She posted that she went into the doctor because her feet were swollen and she had a horrible headache that wouldn't go away in pregnancy. Now, any OB worth their salt should immediately go, we need to check for preeclampsia. They did not check her blood pressure. They sent her home and told her headaches and swelling are normal in pregnancy. And the headaches still wouldn't go away. She took Tylenol. Nothing was helping. I did look at her Facebook profile because I had to know because I had a feeling, and it was a black mother. And I told her, I'm like, you need to go to either labor and delivery triage or a different hospital. You need to have your blood pressure checked because it sounds like you have preeclampsia. I'm like, and do not leave until they check you out and prove that this is just normal pregnancy discomfort. Because there is no reason that a woman complaining of those things should ever be dismissed when you're pregnant. Any
Right, and
woman,
like when do
but
you ever go to the doctor's office where they don't take your freaking blood pressure?
right,
Like that's ridiculous.
the fact that they didn't even check and they just wrote her off, I told her, I'm like, I would be finding a new OB. And I know it's hard. It can be really hard to switch OBs during your pregnancy. It's easier now than it used to be. Um,
Oh yeah, you were like locked in.
hmm
It was horrible.
But do not be afraid to fire your OB and get one who listens. I do know there are some resources. You might have to look them up. I don't know if any of the ones I'm going to link have it. But there are resources to to find OBGYNs who are more, I don't know a good way to say it. OBGYNs who have better outcomes for black mothers. There are OBGYNs who are really good, who are well informed, who are aware of.
So that kind of upsets me. So now if you're a black mom, now you have to like I need to find out, be who is good. Oh my gosh.
Yeah, and
That needs
that's
to change.
it needs to change, really. The standard of care should be the same across the board. And it's
And the
really,
standard of care should be better across the board too.
it really should.
It really should.
Now, one of the things I want to talk about, because it is, Black History Month, um, was talking about the father of modern gynecology. And I'm sure people have probably seen some of this circulating. He was a gynecologist in 1844 who performed experiments on enslaved black women in Alabama. He used no anesthetic because he believed that black women didn't actually feel pain. And unfortunately, or fortunately, depends how you look at it, there are things that were genuinely learned about gynecology from this. The methodology was terrible, but it seems to be that some of that thought process is still pervasive in medical care. And I mean, all women have experienced, I've heard so many women talk about not being offered pain relief for things like endometrial biopsies or IUD placements. The rates are even higher with black women not being offered pain control for procedures that, if you did something equivalent to a man where they would say, oh, it's just a little pinch, they would give him a full anesthetic. Case in point, endometrial biopsies. I've had one. There are technically no nerve endings in the endometrium. It hurt like a bitch, okay? Like, I crawled up the table, wanted to kick the nurse in the teeth, hurt like a bitch. But they do a procedure for men in fertility treatments where they extract immature sperm from the testes using a needle. They get full anesthetic for that. I was told take an ibuprofen. So, and that's just my experience as one white woman. That's not even considering, the additional implied or systemic racial issues that come up in the medical system. And a lot of it stemmed from this belief that there shouldn't be pain receptors there. So why would we need to offer pain control? Or these people don't feel pain. And the same thing happened with babies. They believed babies didn't feel pain for the longest time too, which is crazy. So, I mean, unfortunately, the history is ugly on modern gynecological practices.
It is.
Um,
Unfortunately, the history of like all medicine is pretty horrific.
it is.
It really is. I mean, I'm glad some good came from some of the stuff, but like there was, Mengele.
Mangala.
Yeah, horrifying stuff. So medicine in its early days, a brutal business, and
Yeah,
apparently still is.
apparently still is, and it's oof. There's I mean, I'm not going to go completely into this, the history of the origins of modern gynecology. If you want to read it, I will save the show. I'll save the link to the article. It's Black Subjectivity and the Origins of American Gynecology. But it's a really good deep dive talking about the way that women were black women specifically, and Irish women specifically called out in this, were very unethically treated and just inhumanely, frankly, in the name of advancing medical science. So, but there's so much. I think there's so many factors that go into it. There's no way we're gonna tackle all of it in our 30 or 40-minute podcast for sure.
Well, I mean, I think the important thing is that this is going on, and I
Hmm.
think everybody needs to be aware of that. And as moms, we all need to be a united front.
Yes.
So we all need to speak out about all of these things because it's not okay. Like, I don't want to see any woman in labor. First of all, I certainly don't want to see her die, especially if it was preventable or something that happened to their child. I mean, it's like the most vulnerable position that a woman can ever be in. And you can't, you need to be able to trust your medical team. You really
Yeah.
do. Like,
And
that's horrible.
so I am going to try to drop a bunch of resources. Some of those resources are probably going to be political. Our goal is not to start a political debate here. Um,
No, I
we're
don't feel like these things are political. This is just moms supporting moms.
This is
Wherever you
just,
land politically, it doesn't matter.
and there are disparities to talk about with other races, like
Right, but
moms
it's
of
Black
other
History Month.
races, but it's Black History Month, so we are
Right?
focusing on
So,
Black moms. And I do, if I remember the statistics correctly, Black moms are at the biggest disadvantage in the medical system in this country,
the
which
bottom
is,
line is moms stand up for moms. And right now we're talking about Black moms, but we care about all moms, every
and
mom.
in the sisterhood of motherhood, if you see something like that, whether, you're in a place to step in and say, "Hey, you need to be taking her seriously," or if that's talking to somebody online and saying, "Hey, I really think you should get a second opinion." Like there are little ways, but if we're all doing it, it'll make a difference.
Well, and like I was really young when I had my first kid or whatever, but and I didn't know anything about patient advocates. What are they called? The patient advocate that you can call at a
Patient
hospital.
advocate. Yeah.
Had I known something about that when that nurse said that to me, uh, I would have called, but I didn't because I didn't know anything about that, and I was in labor at the time. But that is something that you can do. There was nothing I could do in that moment for that lady, but it could have been reported.
Yeah.
I, so that is something to be aware of. Like, even though there might not be a lot you can do, there are still things you can do if you see something. So patient advocates, the administrator at the hospital is another person to go to if you hear something that, you're like, what? You
Yeah.
know,
I mean, just don't stand for that. Like, especially we talk I think this episode's actually going out before, but we've talked about before when you're in labor, sometimes it can be hard to speak for yourself. So if you see someone in labor who's not having an easy time advocating for themselves, but they're not being treated fairly, it's okay to call that out. And then another one I saw, and it was a labor and delivery nurse, or was she a doula? She might have been a doula who brought it up, because there was nurses joking about like, oh, if you fire me off your service, congrats, now you're gonna get Donna or whatever name they said, who's like the bitch nurse who doesn't care. Reassigning you in a retaliatory fashion is actually illegal. Like retaliation because a patient has, you know, declined care from you.
Preferences? Yeah. God forbid
Yeah,
you have preferences.
it is actually illegal. So if you are worried about retaliation because you spoke out for somebody else or you spoke out for yourself, definitely get with your patient advocate, get with the hospital administration, whoever you need to. Get a lawyer if you have to. Like, do not be afraid to call a lawyer. And there are a lot of lawyers who will work with you even if you don't have a big budget.
Well, and I know I said this on the show before, and I'll say it again. When you talk to patient advocates and all those, because they do work for the hospital, okay? So, yes, they're there for the patient, but they're still working for the hospital. Don't be afraid to say things like, and I will get a lawyer involved, and I have the fortitude to see that through.
Yes.
So write that down. It is a phrase that works at schools, at hospitals, at any institution because nobody wants to get sued.
And this is advice I would give to any woman, but especially if you feel like you aren't being believed or you aren't being taken seriously, is to document everything. If you have symptoms that are concerning, document those symptoms, get a second opinion. I would be checking my medical records, checking the reports, making sure all of the information is accurately
Yeah, because they
depicted.
notoriously put bogus crap in there.
Notoriously, don't be afraid to call the hospital records department and demand that the records be changed or amended because something was mischarted. Because if you go in and you say, hey, I'm having all these symptoms, but they just chart it as whatever they feel like, because I've had that
Right.
done to myself.
Me too.
I went in to discuss infertility and it was charted as I was combative and declined treatment for my irregular periods, which is not what I went in for at all.
I went in for a squish brain and she charted that she counseled me to quit vaping. I'm still
Yeah.
vaping.
So document everything, get everything you can in writing. Um, if they are trying to discharge you and you think something is wrong, you can make sure that they note that. That should be in the notes in your discharge papers, like that you still think something's wrong, essentially. Go get your second opinions. Don't be afraid to get a second opinion, or a third, or a fourth, or a fifth until you are satisfied that they have proved that you are healthy.
I probably had 12.
Yeah.
I fired 11 people before. So, sometimes it's that. It wasn't a pregnancy situation, but it doesn't even matter. Like, they just really treat women like. I don't know.
Well, and
It's so frustrating to me because I've been there myself, and I know that I'm a lot more assertive than most.
I mean,
So it's frustrating.
counting through them in my head, I went through 7 doctors to find one, and not even, she's not actually a doctor, she's a physician assistant, who believed me enough to run the testing to find out that I had an atypical presentation of hypothyroidism. The treatment was simple, the testing was simple, but it took me 12 years and 7 doctors to get an answer as to what the hell was going on.
Yeah, it's ridiculous.
So I can't even imagine. Like, don't let them dismiss you. Don't let them tell you that
And
we'll
don't let
just
them
give you
gaslight
this.
you.
Don't let them gaslight you.
Because, I mean, they gaslighted me so bad. And I think that a different person might have believed it was all in their head.
And document everything. Now, if you can, if you feel like you are not being treated fairly, recording is why we know about some of the situations happening now. It is not legal to record all the time in a hospital because of healthcare privacy, But if you are not recording other patients or other patient information, and it is strictly you and your information and what your doctor's saying to you, you should be able to record that. So don't be afraid to request to record it. You can even say, hey, I'd like to record this so that I can review this later. Um, but you can request to record as well. But definitely, at least pen and paper, document everything. Have a paper trail. Um, yeah, man, healthcare makes me angry.
We,
And
yeah, we get pretty angry about that all the
it
time
makes
on the show.
it makes me angry. So, another thing I brought up since it's Black History Month, it is healthcare related. There was an article put out, and it is 61 black women who were featured in the United States National Library of Medicine exhibit. And I'm not going to read all 61. I'm just kind of looking through to a few. There was Marilyn Hughes Gaston, Dr. Marilyn. Her study on sickle cell anemia led to a nationwide screening program for newborns.
Oh, that's awesome.
So it's another thing where this disproportionately affects the black community. It took a black woman to fix it. And good on her, she's awesome. Um, let's see, some other ones. Joanne Reed works to promote better healthcare policies for minority populations and recruits minority students into the biomedical field.
Awesome.
Let's see. There's like so many on here. I mean, it's 61, so. Ophthalmologists, pediatricians.
I might need a good ophthalmologist someday.
Ophthalmologist, man. Yeah.
Like if my retinas start bleeding, apparently that's what I think I think it's like a retinal specialist or something. I don't know. Let's just hope that doesn't happen. I don't, doesn't sound good.
Oh, here we go. Judy Ann Bigby served as the director of the Harvard Medical School Center for Excellence in Women's Health and is nationally recognized for her work in educating physicians and providing care to people who have histories of substance abuse.
All right.
So, woohoo!
We like her.
It sounds terrible to say
We like
woohoo.
her.
We like her, but that's the other thing too. Because I know a lot of people who use substances. I won't even say which ones because it could be as, you know, pish posh as tobacco or something more serious. Um, if you feel like your healthcare team is not there to actually assist with your healthcare, you need to find a team who is, because even things like tobacco usage, um, for some people who have heavy tobacco usage, it's actually safer to discuss that with your doctor when you're pregnant and work through ways to step down versus cold turkey, because the effects of complete withdrawal can be worse for your pregnancy than the effects of the drug. So you need a
Yeah,
medical team you
I
can
actually
trust.
had a I actually had a talk with my gynecologist when I was pregnant with you. So with your sister, I quit pretty easily smoking. So I didn't vape then because it wasn't a thing. I smoked cigarettes and a lot. Um, so I quit cold turkey with her and it was fine. But with Lauren, I had a little bit harder time. Um, and so the doctor did have uh, a plan for me to step it down and then eventually stop doing it. So don't be afraid to talk. I mean, find a medical team that you're comfortable with and don't be afraid to talk. Like, they're not there to judge you, they're there to help you.
They should be there to help you.
They should be, yes.
So find a team that feels like you can actually trust them before
And
you
be
settle on who you're
like,
going
so,
to.
yeah, and so you can be honest because I think a lot of people would have just lied and been like, no, I don't smoke.
Yeah. Other ones. Alexa Irene Kennedy. In 1981, she became the first black female neurosurgeon in the United States.
Wow, that's
That's,
impressive.
I think that's pretty impressive
I
myself.
mean, I like a neurosurgeon, let me tell you.
Yeah. Dr. Janice Green Douglas, a fellow of the American Heart Association, was the first woman to become a professor of medicine at Case Western Reserve University Medical School, and she researched hypertension and how cells control blood pressure.
Nice.
Um, Dr. Georgia Rooks Dwell in 1920 established the first maternity hospital for black women in Atlanta, Georgia.
That's pretty cool.
So, like, like I said,
Her
I mean,
name
it
was Georgia, and she.
did a
that's
maternity hospital in
that's like
Georgia.
that's like even better.
That's like so awesome.
Yes.
Um, let's see, where was it? I just saw it and now I missed it. Hang on. Dr. Lena Frances Edwards, one of the first black women to be board certified in obstetrics and gynecology and gain admission to the International College of Surgeons.
Awesome.
So, I mean, I think, unfortunately, women being in the medical field, and especially black women being in the medical field, is much too recent of a trend. Lots of these women are still alive today that are listed on here as the first of whatever. Um, but I think it's a good thing that we have a more diverse population working in healthcare and in research. Because it wasn't until very recently, and we talked about this, I want to say, in a, like a way old episode before the rebrand old, women weren't required to be included in medical studies until I believe my lifetime. So that is less than 30 years that women have even been suggested, not even required, suggested to be included in medical studies. And that's why things like hypertension treatment, heart attack recognition, even in women, is so low.
Right,
So
because it's really weird, but women do not present the same as men. It's almost like we're different.
they don't. And I actually saw, and you know what? Good on him for realizing something was up. Dr. Mike Varshavsky, he's on YouTube. Big, I'm sure everybody watching this probably knows Dr. Mike because he's way bigger than we are. Um, but he had a woman, I believe she was a black woman. She came in for back pain. He's a family medicine doctor. He saw her for back pain. And she mentioned something really offhand about thinking she slept on her arm funny because it felt a little weird. And she just kind of had a little bit of shortness of breath. But, like, whatever, she's was kind of the mindset like it's probably nothing. I probably just slept wrong and I'm tired. And he said, I want you to see a cardiologist. So he wrote an urgent referral to a cardiologist. They told her they wouldn't get her in for another 2 months. He called them back and said, this is unacceptable. She needs to be seen, I believe he said today. And he got her in, and it turned out she had already had a heart attack. But they were
Oh,
able to get
speaking
her
of,
treatment because one doctor decided to advocate for his patient instead of just letting her get lost in the system.
so during COVID and all of that, I went to the emergency room for my headaches for my Chiari thing. I already knew I had Chiari. I knew they couldn't do anything for me, but some jackass was like, well, what did they do for the headaches in the emergency room? So I'm like, okay, guess we'll do this paper trail. Um, so I went in, whatever. They triaged me. They did the EKG and everything. I literally just had a headache that wasn't going to kill me. I mean, I looked bad because I was like all dizzy and stuff, but like I'm like I have Chiari malformation, whatever. I'm not in danger of dying. A lady came in, a black lady, which I guess I didn't really think of it at the time, but I just thought of it now. Um, she had a history apparently of heart attacks. She thought she was having a heart attack. Um, they brought her in, they, triaged her, whatever. I think they gave her the nitro pills or whatever, but she was sitting there waiting in the waiting room. We were all waiting in the waiting room forever because it was during COVID. They tried to take me back before they took her back.
Mm-hmm.
I wouldn't let them. I said, she might be having a heart attack. Could you please take her back? I am not gonna die.
Right.
Yeah. So I made them take her back. I don't know if they did that because she was black or not, but it seems hinky. Like, I literally was not in any danger of anything serious happening to me, and she was possibly having a heart attack. What the
Yeah.
hell? And she had a history of heart attacks because I wasn't trying to listen to what she was saying, but we could all hear what she was saying because we were all there. you know.
Right.
And
Small
she,
quarters.
right. So, and she was so sweet too. She was like, "No, baby, it's okay. You can go." I'm like, "No, you go." No, no. So
Yeah.
I don't know what the reason. I don't know if it was a racist thing. I don't know what the deal was with that, but ugh, I I couldn't believe that. I'm like, what? What?
Yeah. Another one from this list I wanted to bring out to point out because her story was super cool. Some of these they don't have a lot of information on them, um, but Dr. Jane Cook Wright in 1976 was the highest ranking black woman in a U.S. medical institution, and she is known for developing new techniques for administering chemotherapy to cancer patients.
Oh, that's cool.
So, definitely a good one to look into. I'm trying to see if I can find some more information about some of these other like resources I found to help out with some of this.
Link them in the description or
I will
something.
link them into the description.
We weren't wholly prepared for this because
It,
we didn't know we were going to do it.
but
And
this
we're
is the
not
last.
prepared people.
Well, and this is the last chance we'll get to record an episode for February. So
Right,
I want this to go out in February because it is Black History Month.
right.
And I do genuinely think this is something that more people should be talking about because the way that women in general are treated, and especially black women, is just really unacceptable to me.
Well, I don't know how many people are aware of it. So, I mean, I guess we have to start with awareness, and then obviously there's some institutions and stuff that are aware of it and doing some stuff, but there needs to be more.
Yeah, so this one is from the Black Maternal Health Caucus, just a section from it. Says a lot of conversations surrounding the fact that black mothers are dying at over 3 times the rate of white ones focuses on getting a new parent and their baby home from the hospital in good health. This is just one piece of the puzzle. Ensuring adequate, supportive, and culturally competent care from conception to far past postpartum period is crucial. Nothing happens in a vacuum. So, definitely look into some of the resources. Don't settle for medical gaslighting. Don't settle for doctors brushing you off. If you think something is wrong, you need to find somebody who's willing to give you answers. And I'm not saying go in there and start demanding something crazy with no evidence. Like, I'm not saying go in and say, I need a spinal tap right now because Google told me whatever. Please don't do
You
that.
don't want a spinal tap
But
if you
there are some
don't need
things.
one.
There are some things that are genuine red flags.
Well, they should at least be taking your blood pressure.
Blood pressure, anything that can be solved with a blood test, there is no reason to not do the blood test.
Right.
So if you think like a
And
big
there's no
one,
reason for them to not believe your pain level.
yes, and I don't know if the rates are different for black women versus white women versus other races. But things like cholestasis of pregnancy, that's essentially liver failure, and it's diagnosed with a blood test. So if you have any of the symptoms of that, demand they do the frickin' blood test. The biggest symptom of that is your palms and your soles of your feet get really itchy. But things like that. You have the right to advocate for yourself. Bring someone with you to help you advocate if you need to, and just demand better.
Administrator of the hospital and the patient advocate
And
as well.
I'm not I'm not saying all of that to make it sound like all of the responsibility is on you. The system needs to be changed. I don't know where we start, but I know there are places working on it, so we'll drop those resources in the
Well,
description.
unfortunately, you and I both know that as women, you end up advocating for yourself because Jesus.
Yeah.
I mean,
So,
it's not fair, but it is what it is, and that is what we can do right now.
right. So, I think that's all I got. We talked about some badass black female doctors. All right. Well, peace out. I hope this was informative, and I hope you get good health care.
For now, moms, let's all support other moms. I
Yeah,
think that is the
seriously.
message of today's show.
It is, I think, the more important message than me just spouting some
Yes, we
bullshit because
all
I can't
need
get
to
my thoughts
support.
together.
Yes, let's all support each other. And if we all demand better, they're going to have to do better.
Absolutely. So, support moms. I'm going to play the outro now.
Please play the outro.